I would like to first begin by having Dr. Jennifer Avegno, the Health Director for the City of New Orleans, give you an update on where we are in the city with our caseload. You know, we're at 827 with 37 deaths, and I would like to ask Dr. Avegno to come up at this time, and then we'll proceed throughout the press conference.
Thank you, Madam Mayor. Thank you, everyone. We remain very concerned about the number of known cases of COVID-19 that we have in New Orleans. As the mayor said, today's update from the state brings us to 827 cases in Orleans Parish, 37 of which have resulted in death. Compared with other counties around the country, what we know is that we have one of the highest infection rates behind several counties in New York City and a handful of others. To be clear, that's partially because we are doing a great amount of testing, more per person than most other states, and that is a positive development. With our drive-through testing sites that you've all seen and the commercial lab results now really coming online, we will soon have a much clearer picture of the true nature of the outbreak in our community. But again, what these numbers continue to tell us is that we have substantial community spread. Each of us needs to act as if we have been exposed to this virus. That's why it is so incredibly important to continue to stay home right now. The best way to slow the spread is to limit interpersonal contact between individuals to the greatest extent possible. I am really, really happy to say that our community members, all of us, all of you, have been listening. We have been on the streets. We have seen how little traffic there is. We have data from an external source that indicates that over the last week, there's been a huge decrease in the average distance traveled in Orleans Parish, more than almost anywhere else in the country. That tells me that everybody is doing their part, and we are so appreciative. That will save lives, but we have to keep it up. This is a marathon, not a sprint. We won't even be able to see or know the effects of our stay-at-home mandate for another week or more. We should expect that. That's due to the incubation period of this virus, and we expect to have a long road ahead to continue to slow the spread of the disease. So I want to prepare you now, as the governor said yesterday, that in the coming weeks, or even less than weeks, we will be facing a serious capacity problem in our hospitals. As more people get sick and as more people need to be admitted to our hospitals, we may run out of hospital beds. We have been preparing for this for weeks. Our hospitals have been preparing for this for weeks. We have been working with the state on hospital surge plans, which you'll hear about more in the coming days, and the governor alluded to today. Just like other major cities all over the world, we continue to face shortages of medical equipment, personal protective equipment. The major disaster declaration that the president issued last night, we hope, will help to unlock the federal resources that we need to assist in this. Please remember that through all of this, our healthcare workers and our first responders continue to provide care at great sacrifice to themselves and the people they love. Many of them have been exposed to COVID-19 and are continuing to work safely with protective equipment as long as they can. There are many things you can do to support them, and really they and our vulnerable population are who we should be focusing on now. Don't become one of their patients. Stay home, avoid close contact with others. If you're a medical professional and you're not already volunteering or working, please do so. Sign up at ready.nola.gov to volunteer. If you're not a healthcare worker, there are many ways that you can help. Reach out to friends and family who are and see what they need, whether that's to drop a homemade meal off on their porch, to have some groceries delivered, whatever you can do for them. You can donate to groups like the Crew of Red Beans and other organizations that are employing some of our hospitality workers and feeding healthcare professionals every day. That's a win-win. Remember, they came to work for you, so please stay home for them. Thank you.